If you'd like to find your seats, we'll get started on time and make the most of the time available. I want to thank you for coming this morning. I'm Jim Lauer. I'm the McLeod County Veteran Service Officer. And on behalf of the 5 McLeod County Commissioners, welcome to our presentation on assistance options for seniors. Kind of a foreboding name. What we're going to do is we're going to give a little presentation on the kinds of things that for those of us that are getting older and those of us that have already reached that senior citizen title, what are some things you need to be thinking about, either currently being used or for planning. And what we've done is we've partnered with the Minnesota River Area Agency on Aging. Now there's a tongue twister. And the Senior Linkage line to kind of cover this. Laura Thomas is an expert presenter on these things. I've sat through her presentations before. She's a great resource to this part. And we're going to let her cover a lot of those details. At the end, we'll take a little bit of a short break while we bring up people from McLeod County Public Health, Laura, Social Services, and Veteran Services, just to see what kind of questions either came up during the presentation or that weren't covered in the presentation. As we do that changeover period, we've got cards in the back that you can write your questions on if you want somebody specific to answer it or you just want to throw it out there for everybody else. So we'll let the presentations go, we'll hold the questions to the end, and then we'll take care of that. So without any further ado, I'm going to introduce Laura Thomas and let her give you some great information.
Thank you. Good morning. Well, I think it's interesting that Jim, in his introduction, said that this title can sound sort of foreboding, right? Like what's to come or what's going to be happening. And I sure hope after the presentation that you feel maybe a little more comfortable with the topic or with asking any questions. My name is Laura Thomas, and I work for the Senior Linkage line. I'm an information and assistance specialist. And as Jim mentioned, Senior Linkage line is part of the Minnesota River Area Agency on Aging. And there are actually 6 AAAs, Area Agency on Aging, in Minnesota. We're in the Minnesota River area. And I live in Willmar. I work out of Willmar, and I have a 9-county area that I'm responsible for. So if you haven't heard of Senior Linkage line, there is a nice rat card on your chair. And if you don't have information on the chairs where you're sitting, make sure that you grab some from a neighboring chair because we will be using this information throughout the presentation. What you'll see, though, is a card. It's 2-sided, and it gives more information about what exactly Senior Linkage line is. One of the main services that we have as the linkage line, it is a telephone line. It's a telephone number. And if you see, it's a 1-800 number. And I know when people see that, they might think, now wait a minute, am I going to understand the person who answers the phone? Are they going to have any idea what's happening here in Glencoe or in my area? And the answer is yes. Because I'm one of the people that takes calls for Senior Linkage line a couple days a week, okay? It's your link to a local aging expert, and all of us have degrees in nursing, in healthcare, or in social work, or in education. And I'll tell you what, we do have like extensive Medicare training, as that is one of our specialties. We are the state's designated Medicare health insurance experts, but we do also take questions about really anything that's related to aging. So if you take a look, there are 5 different sort of headings or main topics. Things like housing resources. Sometimes caregivers will call, and that reminds me to say, although the name is Senior Linkage line, there certainly isn't an age minimum or age maximum for you to call. So we get a lot of calls from caregivers who say, I'm kind of concerned about my mom. You know, I don't think she should be driving anymore, and I'm not sure if she should be living at home by herself anymore. Okay, so we're able to talk about what kind of resources are available, and we'll see that a little bit in the presentation as well. Health insurance, as I mentioned, we are the state's designated Medicare experts. So we get calls when people have concerns about paying for their prescription drugs or what type of supplemental coverage they should go with. There's going to be a whole type of supplemental plan that's leaving the market in 2018, so I know we'll be getting a lot of calls about that. Keep our number in mind when open enrollment comes around. Financial assistance. We also offer things like forms assistance if people need help in filling out some paperwork that's confusing. Aside from taking calls for Senior Linkage Line, we also provide in-person services. For example, presentations like this. We do offer Medicare classes in many communities. I started this position in January, and I currently have classes now in Wilmer, Benson, and Olivia, and I'd love to get some Medicare classes started, like in Hutchinson or in Glencoe, so watch for that coming soon. We also offer in-person assistance once a month at the Hutchinson Event Center from 11 to 1. It is the fourth Tuesday of each month, and there are cards on the back table that have information about that. Another part of Senior Linkage Line, if you flip your card over, you'll see the minnesotahelp.info website that's listed. And this is a wonderful database that has really all of the resources that we use when we're assisting callers or answering questions. There's a chat feature, so if maybe you're not sure you want to call and talk to us, you can chat with a specialist through that website as well. Senior Linkage Line, all of the information that we present is unbiased and comprehensive. And it's also free. We never charge for our classes or for calls or anything like that. But in order to receive our funding, we do get state funding and then federal funding as well. And in order to continue to receive the funding, we have to show the government that we are providing the services that we say we are. So for that reason, I'm going to pass around 2 clipboards. They have sign-in sheets. It asks for some information, such as your name, your address, your birth date. The reason this information is collected, like I said, it's to pass on to the federal government. We don't use your information for any, for any purposes other than that. And in fact, Senior Linkage Line does follow all state and federal privacy laws. And if you're interested in more information about those, I did include some of the privacy notices behind the sign-in sheet, so you can feel free to grab one of those. And of course, with any time that anyone is requesting your private information, you're free to give as little or as much as possible. So I'm going to start sending these around right now. Another item that you may have noticed on your chair, aside from the information about Senior Linkage Line, and then this Planning Ahead brochure, which we'll talk about in a moment, is an outreach survey. And this is another way that we continue to receive funding. Anytime that we do presentations or classes, we ask that the participants fill out the survey, and then you'll notice that there is an envelope with the postage paid, and it does go directly to the State Board on Aging. On the back side, you'll see highlighted, it says staff or volunteer. You can write the name Laura, because that's me, so that's who you're going to be evaluating and who the state will be receiving the feedback about. So if you have any questions about the information on the clipboard or the community surveys, please let me know. All right. So today, I'm going to be speaking on the topic of Own Your Future, Minnesota. Okay, and this was, so we have sound effects with this, I guess. Maybe I can mute that. Own Your Future is a joint federal and state effort, and it began in 2013, okay? And the reason that it began is because At that time, the lieutenant governor of Minnesota had gone through some real difficult times with some members of her family. They hadn't been prepared to face some of the issues that came up as they were aging, and it caused some real issues for her family. So as a result, she decided this is something that I think is real important for the residents of Minnesota to be aware about. So that's where this initiative came from. And the purpose of it is to encourage and enable individuals to plan for long-term care, including how to pay for long-term care. Okay. Sounds sort of futuristic, which I suppose is appropriate given our topic of talking about the future. Okay, so the lieutenant governor, she faced issues with her family because these were topics that just hadn't ever really been discussed. Okay, and she wasn't clear on how her family members, what they wanted or what they had in mind, and then suddenly a crisis happened and no one was really sure what to do. Okay, when I think about my family and aging or facing death, it's not something that we ever talked about. Now, I did have one grandma, my mother's mother, and she was always talking about, she was a nurse, so maybe that kind of helped her become immune to talking about it. And she would always say, when I die, I want this, or when I die, I want that. She also was the grandma who would ask our Baptist pastor each week on the way out of church how his love life was going. So she didn't really mind talking about anything. But when I think about even like my parents, or when I think about myself and what I have done to plan for this event, which really is expected, right? Because we all know we're going to die someday. It's just not something that many people are prepared for and maybe not always comfortable talking about as well. So the purpose of this is really to open the topic, to talk about creating a long-term care plan, and talk about getting all the documents together. How can I organize the information? What goes into my planning? The booklet that you have on your chair, we're going to be referencing this, and you do have a pen so you can take some notes in your booklet, or write down any questions that you have. I know Jim mentioned the cards at the back, because we'd love to talk about those. If you take a look in the booklet, on pages 1 and 2, you'll see the introduction to planning ahead, and it really goes through all of those who, what, when, where, why questions. Okay. So the first question is really interesting. It says, who should plan ahead? And as I read through this and thought about it, it really made sense. It says you're never too young to start creating your long-term plan for yourself. Okay, I live in Wilmer, and I was thinking about it as I was driving here. We know that death is expected and it's going to happen someday, but what about planning for events that are unexpected? Okay, and I thought about this as the car that was coming in the other lane, right, started swerving toward me, and then at the last minute it jerked back, and they probably had thrown their cell phone in the back because it was really kind of a scary thing, right? So when to start planning, or who should start planning, it's never too early, right? And it's something that all of us should take a look at. Okay? When we talk about creating a plan, what should our long-term care plan include? Okay? Well, this has some real great suggestions. We'll be talking about long-term care. How am I going to pay for it? How do I want that care to be delivered? We're going to talk about incapacity. What happens if I'm unable to make decisions for myself? Who's going to take care of that? Okay, and then of course we'll also talk about death, because as we know, that is something that's expected. We can plan for it. Okay, why plan ahead? And I was thinking, as I mentioned, for me sometimes talking with my family members or loved ones about death or about aging, sometimes that can feel really uncomfortable. Well, I don't like to feel uncomfortable, right? So I just avoid it. But if I think about aging and the consequences of not preparing for aging from a financial standpoint, then that's something that suddenly makes me think, now wait a minute, Laura. You don't want to be in a position where everything is turned over by the courts to a guardian, or it goes into conservatorship because there's no plan in place for you. Oftentimes, we'll talk about this a little bit more, but when a crisis happens, usually, you need things immediately, and you need the resources immediately, and often those are a heck of a lot more expensive, right, than things that you've had time to plan for and prepare for and have that plan. So I think there really is that financial piece that maybe engaging with your feelings isn't comfortable, but thinking about the ramifications. Also, there's this piece I'm kind of stubborn. I don't want somebody making my decisions for me. I want to make sure that exactly what I want is exactly what happens, and I guess everybody should know about that. Okay, so we can look at it from that perspective too. Okay. When should you plan for incapacity? And we sort of mentioned this, right? It's never too early. If you're 18 years old, you can have your power of attorney. You can have a healthcare directive in place. Okay, and of course, those are living documents, right? They're things that we may take a look at every 5 years and change, because sometimes our preferences change. Sometimes maybe the people that we associate with or our relationships with family members change, and so we want certain things in our documents to be changed as well, and that's okay. Where to keep a plan. This is also, I think, a good piece of information. If your plan is locked away in a safe deposit box, who's going to be able to access that plan when you need it? Okay, we'll talk a bit more in a while about how can I make sure that everybody's aware of my wishes, or everybody knows how to find the information that they'll need when it's needed. Okay, so we're going to talk about a variety of different aspects of planning for long-term care. Okay, we'll talk about help with personal cares. Who's going to assist me in managing my medications? Household tasks. Okay, we'll talk about securing your future by knowing what your options are. And then, of course, we'll focus on planning wisely and taking action. Okay, like we said, it's never too soon to make sure that your documents are in place and that you have this plan. All right, so the first, one area that we'll talk about is personal planning. Okay, did you know that 92% of long-term care services provided to frail elderly are provided by family and other informal sources? Okay, maybe you've given care to a parent who was aging or to a relative that was getting older, right? So our informal networks really are important resources, and we see that a lot. I do in the calls that I get for Senior Linkage Line. There's an estimated 679,000 Minnesotans who are currently caregivers for an older adult in their life. Okay? So who can you count on for help? Your family or friends may be able to care for you if you become ill or disabled. Okay, so that's something to think about. Care from family or friends can also supplement care from paid service providers. Some people prefer to receive care from family or friends, while others don't want to burden their loved ones with the responsibilities of caregiving. Okay, so that's something to think about. How do you feel about relying on family members for help? Is that an option for you? Okay. When we talk about personal planning, right, and long-term care planning, it begins by having honest conversations with those who are closest to you. Okay? It's sharing your feelings that maybe we don't always like to talk about so much, but opening the conversations, right? Learning about what your spouse or your partner, what are his or her views on aging? What did he or she have in mind as far as where the care would come from when it was needed? Okay, after you've had conversations with those who are closest to you, then it's time to start expanding the conversations, right? Talking to adult children or other important adults that are in your life about what your preferences are, getting feedback from them and seeing what they're open to. Okay, so here are some good tips for starting conversations. It says, look for natural ways to start the discussion with members of your support network. I think I mentioned that I didn't always talk with my family members a lot about really anything that was important. I remember one morning, I was probably in 5th grade, and I went to sit down at the breakfast table, and my mom had put a pamphlet about the birds and the bees like on top of my bowl of cereal. And, I just kind of looked and, of course, crumpled it up and probably put it in my pocket like embarrassed. But there really are some ways that we can open conversations with people. And one way that I thought about was, what about watching a movie together? Okay, there are some great titles that deal specifically with aging. Away from Her, that came out in 2006, and I remember watching that, and it really opened my eyes to a lot of the realities of aging. Still Alice, I believe that came out in 2013 or 2014, and similar topics. And then also recently there was the movie Glenn Campbell, I'll Be Me. Okay, so those are 3 suggestions that I thought of, maybe watching a movie together and then talking about what you see, and that's kind of a nice way to segue into topics about what will happen if one of us has a dementia diagnosis. Okay, how are we going to face the future together? Another tip is to make sure that your support network know your preferences in the event of a sudden or terminal illness that might leave you unable to communicate your preference. Okay, so right now we're talking a little bit more about the informal planning that we do. In a bit, we're going to talk about creating a healthcare directive and what that document includes and who we want to make sure has that information. Okay. Of course, a real useful tip is remember that listening is also part of communication. Okay, family members or friends may have ideas that are completely different. Their preferences may be completely different, and so of course we always want to be aware that we might not like what we hear, but we are in charge of what we want for ourselves. Okay. We talked about when to start this planning, and I love this tip. It says, putting a plan in place before a crisis occurs can help make sure your long-term care choices are known, understood, and respected. Okay, do not wait until a crisis to talk to your loved ones. Because think about what happens when that crisis situation comes. What kind of conversations happen during that time? We talked about how often those emergency resources that you need to access right away are incredibly expensive, right, compared to ones that a little planning would have allowed you. Let's take a look at pages 3 and 4 in this booklet, because it gives us some specific ideas for what a long-term care plan should include. Okay. So in blue at the top, it says organize, organize, organize. And then the second black heading says creating your own planning ahead document or notebook. All right. And then it lists 8 different topics or areas that should be included in that notebook or in that binder that you put together for yourself. And it is a great idea to get a 3-ring binder where you can compile all of your information. Okay, the first it says is personal data, right? Some things that we may not think about. Addresses of previous residences that have been used. Okay, sometimes when people need to call to Social Security as a power of attorney and there's an old address on file, it can really create problems. Okay, so this does have a lot of great suggestions for what specific items should go into that long-term care planning notebook that you have. Okay, so financial planning. How am I going to pay for long-term care? I would say that once a week at Senior Linkage Line, I receive a call from someone who is either inquiring about how much an assisted living facility costs, or they're calling and wondering, is this really accurate? Is this really the amount? And I think that sometimes we're not always aware of how expensive long-term care can be. And these numbers show us, these are annual numbers. So your care will cost, if we're talking about home health care, right, that could be $20,000 for a year with 2 or 3 home health care visits per week. Okay, if we talk about assisted living facilities, that could be about $40,000 for 1 year. And that may just be the base rate, right? Then if we're talking about adding other services, that's going to increase the cost. Finally, a skilled nursing facility, those costs can exceed $70,000 for 1 year. Let's take a look at page 5 in the booklet, because we're going to be covering this information. It says really in real bold letters, long-term care is expensive. Just some more information about those costs and how they're incurred. Some facilities charge extra for services beyond the basic room and board charge, while some charge fees that cover everything. Okay, so that's something that's good to be aware of. Is this assisted living facility, is this one cost and I can add as many services as I'd like? Or is this a base fee and then for each meal that I have delivered or prepared, a fee is added? Okay, home health and home care providers deliver services in blocks of time, so 15 minutes up to 2 hours called visits. An evening, weekend, or holiday may cost more than a weekday visit. Okay, and some community programs such as adult daycare charge a per day rate which may differ based on the type and the amount of services offered. Okay. And we talk about the costs of long-term care, and I know some people think, well, I'll have Medicare when I turn 65, so that'll take care of it. I don't need to worry about it too much. Well, let's talk about and kind of debunk some of the myths of what sources will and won't pay for this long-term care. Okay, when it comes to private health insurance, most does not pay for long-term care. Okay, when we talk about long-term care, there really are 2 different types. Okay, and the way that insurance companies or the way that Medicare classifies the types of care, there's medical and then there's custodial. Now, custodial, well, of course, that's things we can imagine that the name suggests, right? Like helping with house cleaning or arranging meds. But actually, the daily living activities like bathing, getting dressed, walking, those are all classified as custodial as well. Okay? Private health insurance may pay for some nursing home and health care, but usually that is limited to the skilled nursing care. Okay, it doesn't include the custodial. Disability insurance. Even long-term disability does not pay for long-term care. It partially replaces your income from wages while you are unable to work because of a disability, although this may only include work-related disabilities. Benefits end when you are able to work again, retire, or reach a preset age, which is often 65. Okay, so Medicare. Medicare began in 1966, and it was never designed to be a comprehensive type of insurance. Okay, and we see that, right, as we look at the co-pays where the beneficiary is always paying 20%. Medicare does cover skilled nursing facility stays, but under real specific circumstances. Okay, Medicare only covers skilled short-term care in a nursing home following a 3-day hospital stay. So you can't just go to a nursing home and you can't enter a nursing home without a 3 midnight inpatient hospital stay if you want Medicare to cover it. Okay, so that's one of the limitations of Medicare. There must be that 3 overnight inpatient status hospital stay for Medicare to cover skilled nursing facility. And then Medicare will only cover up to 100 days of the stay. Okay, the first 20 days Medicare covers completely, but then days 21 through 100, the beneficiary is paying about a $167.50 copay per day for days 21 through 100. And then after the 100th day, the beneficiary is paying everything out of pocket. Okay, so Medicare covering skilled nursing facilities really is just short-term. It's not a long-term care option. Okay. If you need skilled care, such as nursing or therapy, Medicare may pay for care in the home. However, this is also limited and does not cover custodial care. So for Medicare to cover home health care, the services that it's paying must be ordered by the doctor. They must be medically necessary. It doesn't cover the custodial things. And you must be considered homebound, which means you aren't able to leave your home. Maybe they'll let you go to church once a week, okay? But other than that, you must be considered homebound and not able to leave the home. Okay. Medicare health plans. Some people receive their Medicare coverage through Advantage plans, and those don't. Those follow the same rules as original Medicare, so you're not going to get any extra assistance from a Medicare Advantage plan or Part C. Okay, and Medicare supplemental policies work the same way, right? They're providing supplemental coverage to Medicare. If Medicare doesn't cover something, they're not going to fill the gap between what Medicare covers and what you must pay. Okay, now some people think, well, I'll just take my chances, and I know that the state will step in eventually. And it's true that Medicaid, so that's the federal name, medical assistance is Minnesota's state name for the program. It is a major payer for long-term care services, but people only become eligible for Medicaid or for medical assistance when they have spent down the majority of their resources. Your income for a single person, the monthly income cannot exceed about $1,000, and there's an asset limit of about $3,000. Okay, so it really is true. All of the resources and assets must be spent down to qualify for that. Okay, and it says you should not depend on Medicare or medical assistance as your plan to pay for long-term care expenses, because eligibility for these programs and the benefits that these programs offer can change at any time. Okay, so we see here some financing options to consider. Okay, personal income and savings, long-term care insurance, This is something that we always suggest reading the fine print very carefully before taking out a long-term care insurance policy, because typically the policies will require like three different areas of service before they'll start to pay for that skilled nursing care. Okay, so of course, as with everything, read the fine print carefully. Long-term care annuities, health savings accounts, home equity options. And I'd also like to point out in the front cover of this packet, there's a great website. This is the Own Your Future website. And on here, there are 2 other financing options that are being discussed in Minnesota currently to become options for paying for long-term care. So you can find more information out about those at this website. Something I'd like to say going forward is I am going to be providing some websites for you to check out with information. Okay, if you don't have a computer, if you're not comfortable using the internet, you can always feel free to call us at Senior Linkage line, right? And we can print off the information and send it to you. We can walk you through everything it says, okay? So please don't feel frustrated. You can always give us a call, and I know you've got our number now on your pen and in that brochure. Okay, so let's talk about housing planning. How can you stay at home and age in place? If you need to move, where can you move? Okay, so take a minute in your mind and think about where you're living right now. Think about how your home is laid out. What if something happened and I needed a walker in order to get around? How would that affect my daily life in my home? These are some of the suggestions or things that we talk about when we discuss housing planning, okay? Things that we might not think about at first, but when we stop and, kind of imagine ourselves in the position, oh, it makes sense. Removing scatter rugs, okay? Things that can cause trips and falls. Are the smoke detectors in working order? Replacing doorknobs with ones that are easier to use. Adding a railing to outside steps, okay, grip bars for bathrooms, raised toilets, replacing floor coverings with slip-resistant carpets. Okay. Modifying your home is an important option that can improve your safety to perform daily activities such as bathing and cooking. Okay. Here are some home modification suggestions. At Senior Linkage line, we can provide you with numbers to like a consultant that would go out and meet you in your home and help you determine what kind of modifications would make my place safer for me to stay in. Okay, so give us a call. We can provide you with the information to someone in your area. All right. Maybe moving is something that you've considered. Some people think about downsizing, right? Moving to a home that's one level. Options that provide housing with services, okay? So those are things like an assisted living facility, boarding home, congregate housing, retirement communities. Here's one of the websites I mentioned that I added to the presentation. And it's called LongTerm Care Choices. And this is a wonderful navigator tool that helps you walk through what your priorities are for where you're living and what sort of resources or places are available to help you be able to make sure that you're meeting your priorities. Okay, it's longtermcarechoices.minnesotahelp.info, and yeah, that is on the same website that you have on the back of your card. You can give us a call at Senior Linkage line too, and we can walk through that together with you. So when we think about planning for where to live or where to stay, these are some questions to consider. How do you feel about making a change in your living situation? Will the setting require you to share some of the living space, such as a living room or dining room, with others? Can you afford this type of arrangement, including the housing payment and the cost of services, especially as your services needs increase? Do the benefits of having support and services available outweigh the loss of some privacy and control? Okay, so now we're going to talk, that was a little discussion about maybe some of the informal planning, right? Starting to think about what my priorities are, how am I going to proceed, what's going to be important to me. Now let's take a look and talk about some of the formal planning and preparation in the form of documentation that we can begin to put together. Okay, so there are risks in relying on informal arrangements or informal agreements, right, with family members especially. And I'm sure if we just stop for a moment and think about what some of those are, it wouldn't take long to compile quite a list. So of course we do suggest making sure that you have your documentation in order. Now when we say documentation, what are we talking about? On pages 11 and 12 in your booklet is where it begins to talk about what those documents are and what some of the risks of relying on informal arrangements may be. And then you'll see that it talks about formal arrangements, so other things to consider: automatic banking and direct deposit, multiple name bank accounts, okay, naming a representative payee. It has a lot of great details about that. What documentation do you need? We're going to talk a little bit now about two types of documents that you can actually prepare for yourself to be prepared for the future. Okay, the first is on page 15. Okay, it talks about having a power of attorney. And of course, look, at Senior Linkage Line, we never offer legal advice or information like that, but I would like to share some information with you, and that is that it is possible for you to create your power of attorney. The documents are available, and you can see, you can find it through a Google search. Actually, I typed in Minnesota Department of Justice power of attorney, and it took me right to the PDF. You can call us at Senior Linkage Line, and we could sure send you out a copy of this as well. It's 5 pages, and it's brief, and it's fairly easy to complete on your own. Okay, so this doesn't need to be something that costs a lot of money or that takes a lot of time. It's a document that's really easily accessible and can make a real difference in what happens toward the end of your life. Okay. The other document that we'll talk about is a healthcare directive. Okay. So in 1998, and let's see where that is in our booklet. Take a look at page 24 in your booklet. Okay, on page 24, under the last bullet, it says, is a healthcare directive the same as a living will? Okay, so maybe living will is a term that you're familiar with. And it says no. In 1998, the Minnesota legislature created the Healthcare Directive, which takes the place of living wills and durable powers of attorney for healthcare. Okay, prior to 1998, you had to have a living will in place to appoint someone to make decisions for you when you were in a terminal condition. You also had to sign a durable, right, that's that power of attorney for healthcare, so that you could have an agent to make decisions for you, review your medical records, and discuss your condition with your doctor if you were incompetent but not in a terminal condition. The healthcare directive combines both the living will and the durable power of attorney for healthcare into one document. If you have a living will and you prepared it before August 1st, 1998, it is valid. If you prepared it after that date, you should have a new healthcare directive prepared. Okay. Now, the University of Minnesota took time and did a lot of research, and they put together a healthcare directive document that's very easy to use. Okay, they made sure that it had simple language and that someone could sit down and fill out for themselves or maybe fill out with a family member to make sure that what they wanted in terms of care, in terms of how long to live or how they wanted their death to happen, to make sure that they had all of that information down and then authorized. Okay, so I think it's kind of exciting because here in Minnesota, we are able to, we can do the financial side, right, the power of attorney, and we can also do the healthcare side with the healthcare directive. We can really do it for ourselves. Now, of course, we'd always suggest that, if you'd be more comfortable having a lawyer help you do that, or talking to someone, with legal experience, but you sure can take a look at the documents for yourselves. mnaging.org is where you can find the healthcare directive template. And then the website previously, as I mentioned, that's where you can find the PDF for the power of attorney forms to fill out. Let's talk a little bit about what a healthcare directive is specifically. Okay, it prevents confusion and makes sure that your wishes are carried out. It helps your family and close friends know exactly what you want so they can support your wishes. As we talked about, in Minnesota, the healthcare directive has taken the place of a living will. Okay, the healthcare directive is a document that was developed in Minnesota, and it's for use here. So if you live elsewhere for more than half the time, then you likely want to consider having a living will in place and the durable powers of attorney for healthcare in place as well. Okay, but if you're in Minnesota, this is the document to use. Okay, health professionals consult your healthcare directive when deciding on treatment options, and it is a good idea to review your document from time to time. Okay. The healthcare directive, I don't know if anyone has completed one of these or has seen one of these, but as I mentioned, it uses very simple language. It's easy to understand, right? It's not like, I feel like, oh my gosh, 50 pages of legalese, how am I ever gonna get through this? One of the main important pieces is that it asks you to nominate or to name your healthcare agent. Okay, and the healthcare agent is the person that then you are signing the power to act on your behalf. Okay, it has great check boxes where you can check which powers you'd like that healthcare agent to have. So it says things like, my initials below indicate I authorize my healthcare agent to make decisions about the care of my body after death, make healthcare decisions for me even if I am able to decide or speak for myself if I so choose. Okay, there's lots more information. There's a section that has the healthcare instructions. All right, and like I said, it's nice because it gives you options. So you don't have to, write specifically, but it lets you think about, I want CPR attempted if my heart or breathing stops. Or another option, I want CPR attempted if my heart or breathing stops based on my current state of health. However, in the future, if my health has changed, and it gives some examples, then they should look at these options. So it kind of walks your healthcare agent through what exactly you want for yourself at the end of life. It has a section where you can write about your treatment choices and how you'd like those delivered. It talks about organ donation and autopsy, okay? And then it also includes part 3. This is an optional part, but this is, I think it's really nice because it gives you the opportunity to share your thoughts so you know that those will be carried out. It says, I want my loved ones to know my following thoughts and feelings. The things that make life most worth living to me are, my beliefs about when life would no longer be worth living are, my thoughts about specific medical treatments, if any, my thoughts and feelings about how and where I would like to die. Okay, so this, it has information about your religious affiliation and any funeral information that you'd like. Okay, and then of course it has the place to sign with the witnesses. It's a great document. It's easy to understand. It's easy to access. You can call us at Senior Linkage line and we can get a health directive sent out for you and ask any questions that you may have about that. Okay, so when your healthcare directive is completed, what are the next steps? Okay, this is a document that we want people to be aware of, to know that it exists, right? Asking your doctor, your healthcare provider to incorporate it into your health records, talking to your loved ones about it, going over it with them, making sure you're answering any questions to avoid any possible conflicts or issues, giving copies to your doctor, healthcare agent, family members, loved ones, attorney, clergy, and others who may need to know your wishes. Okay, they aren't meant to be kept locked away. These are, this is information that we want people to know so that they can use then. And then here are a couple of great phone numbers to call. Of course, there's Senior Linkage line. If you would like more information, any of the documents that I've shown or talked about, I know we will have a time for questions, so that's a great time to ask those too, but you can always give us a call. We also have the number for the Disability Linkage line. There's the website that we talked about, minnesotahelp.info.